Hi, I'm Denise Krause, and I'm running for State Senate District 3. Southern Oregon is a very special place to live, but we certainly have our share of problems. And right now, we seem to be in crisis everywhere we turn. We have a very high cost of living, and the wages aren't keeping pace. And a lot of people, families, and working people can't afford to live here and are having to move away. And taxes continue to go higher. Education is suffering and not getting adequate funding. Healthcare is a real problem. We have a healthcare desert here. It seems like we have a lot of services, but when you start looking for a provider, there aren't enough providers, there aren't enough specialists. And our hospital in Ashland is being closed or being dismantled as we speak. Parts of the service is no longer being offered. I do see in all this crisis opportunity. I want to throw out something and have a community conversation about one idea that want to share with you. So one of the crises we're facing here in Southern Oregon is with Ashland Hospital. This is one of the economic drivers of not only Ashland, but all of Southern Oregon. So right now, Asante, who owns the hospital, has decided to close the birthing center and also inpatient services. That's terrible for Southern Oregon. So the problem, though, is, Asante is focused on the bottom line. That's what healthcare is like today. So really what we're seeing is a focus on profit over people. And as a result, rural hospitals are closing all over the country. And an Ashland hospital is just another one of those casualties. So what I would suggest is to work very hard to get the $4 million that Asante will owe Ashland for breaking the contract. And let's work on a new solution. As I said, this is an economic driver for the whole of Southern Oregon. This is really important and needs to be saved. So let's think creatively. Let's think bigger. What could we do to save this hospital? What do we want to see? What do we need in our community? When we don't have health care, people don't move here. This is another problem. We need to be able to serve our community better, not less. More health care, not less. Southern Oregon University is another very important economic driver for Southern Oregon, not just for Ashland, but also the whole area. SOU is really struggling right now. Education is completely underfunded. Oregon is 46th in funding education in the rankings nationwide. That is completely unacceptable. And SOU is really feeling it. They've had to cut a lot of programs. They've had to cut way too many faculty and staff, and enrollment is declining. A college town adds so much to a community, makes a community vibrant and dynamic. This is such an important thing for Southern Oregon. SOU, we need to do something about this. Education needs to be a priority. But again, it could be that in crisis there is opportunity. So real briefly, I want to tell you what my background is in my career. I was 25 years employed at the University of Mississippi Medical Center. I was in healthcare administration and population health. But what University of Mississippi Medical Center is an academic health science center, one of 256 in the nation. It's the only one in Mississippi. There's one in Oregon, Oregon Health Sciences University. So that is the closest academic health science center to us, and it's in Portland. The next closest is the University of California at San Francisco. Right here at SOU, we're basically roughly in the middle of those two, a long way to either one, about 5 hours either way to get to an academic health science center. And again, I'm going to refer to Southern Oregon as being a healthcare desert. So we're having a number of problems in the community. Our hospital is being dismantled. Our university is struggling. Our community, people are leaving the community. It's hard to bring people in. It's hard to bring new students in. It's hard to bring new families in. What about jobs? Jobs are leaving the university at the hospital. So what if we think bigger? There might be a way to address a number of these issues at one time. Let me throw out a possible scenario that could address a number of these issues all at once. What if we SOU partnered with Oregon Health Sciences University, and became like a satellite medical school in Ashland and have a teaching hospital at Ashland Hospital. That makes sense because OHSU is on one side of the state, Ashland is on the exact opposite side of the state. It's equally in between the nearest two academic health science centers, and it's on the I-5 corridor. So another reason why this makes sense to me is that the OHSU, Oregon Health Sciences University, nursing program is here. We have a nursing program here on the SOU campus. Makes sense to have a physician's program along with the nurses. So at SOU, you could have the nursing program that already is, and then add a physician program. And that would be very supportive, and then you would have a teaching hospital right in town. What would that do? It would bring in faculty, it would bring in students, it would bring in staff, not only at SOU, but also at the hospital. It would bring in good jobs, it would bring in young families, it would bring a vibrancy back into the community and establish or reestablish both of these two really important economic drivers for Southern Oregon. Now, this isn't just about what could happen in this area with SOU and with the Ashland Hospital, but this is much bigger. As I say, this is about Southern Oregon. This can involve a lot more than those two institutions because with a medical school, we will need to have rotations. And we will need to have rotations. Hopefully, we could do that with Asante, with Providence, with Sky Lakes, with Three Rivers and Grants Pass. And the whole area can be involved in this economic driver. We need more physicians. The best way to have physicians that want to be here and stay here is to train them here. But in addition to that, we also need residencies here because we don't want you train them here, then they go off to residency and they stay there. So we will need all of these healthcare institutions together to be able to build a healthcare system that supports this and also provides residency programs. So what is an academic health science center? It has three missions. One is clinical care, one is education, and the other one is research. That's what I spent my whole career doing. We can bring in research funding, and that's something that I did as part of my career at the University of Mississippi Medical Center. But we could bring research dollars into our communities here. Okay, so in summary, why don't we have community conversation about establishing a satellite campus for Oregon Health Sciences University here at Southern Oregon University in conjunction with the Ashland Hospital. The Ashland Hospital would become a satellite facility of OHSU, a public hospital, a teaching hospital, a hospital that puts people before profits. Vote for me, Denise Krause, for Senate District 3, and let's build a better future together.